I'm a myofunctional therapist, but I'm also a patient advocate. I've been through the system myself as a patient. I've worked in the system as a healthcare provider. I work with doctors all the time. I know how to navigate the system. So I have a privilege of being a patient and also being a provider. So I tell my clients, probably 40% of what I do is myofunctional therapy with you. The other 60% is herding cats. So I make sure, when was the last time that your endocrinologist emailed your primary care physician? Probably never. I'm just going to go on a limb and say never. So I get all of the providers, if we're working with an airway dentist, if we're working with an airway ENT, working with me, a myofunctional therapist, I get everybody on an email thread and I say, hi, welcome to the team. Everybody, we are working on Meredith today, and we're going to do this, this, and this. Who's doing what when?
This is Meredith for Real, the Curious Introvert, and I'm Meredith. I explore the questions people think but don't ask out loud, either because they're taboo or thanks to cultural hypnosis. My mission, and yours if you choose to accept it, is to inspire curiosity by exploring the nuance and paradox of our world. Each episode is different, so bring your ADD and your earbuds and have a look around. Hey Curiositors, it's me, Meredith. Today's episode is another thought exercise in seeing yourself as a whole person. You might be thinking, yeah, duh, Meredith, of course I'm a whole person. I don't mean to say that I think that you think that parts of you are missing. I mean to say that we often think of our systems as contained versus interconnected. And as it relates to this episode, you likely don't think of your tongue as connected to your sleep, or your stress, or your digestion. My guest helps connect the dots, but also gives some practical tips at the end. She and I will be on Instagram together the week that this airs, talking about more of this type of thing, so be sure to follow me there at Meredith for Real. If you end up liking this episode, you might also like the one I did with the researcher and inventor who helped develop de-stressing earbuds. That's episode 154. A lot of discussion about the vagus nerve in that episode and in this one too. And if you're a repeat listener, thank you so much for making me and our guests a part of your routine. Be sure to hit the subscribe or follow button on your favorite podcast app so you don't miss an episode. And if you're new here, welcome. Around here, we press play to get curious, disrupt the algorithm, and grow into better humans. We talk about everything from adult friendship to American masculinity. So be sure to bring your ADD and your earbuds and have a look around. There's no specific order to listen to episodes. Kids, career, mortgage, marriage, looming economic collapse. So many first world problems to cause you stress. But what if the source of your chronic stress was actually your tongue? My next guest is a registered dental hygienist, certified myofunctional airway specialist, and orofacial myologist. That's a mouthful to say. She's basically a trainer for your tongue and mouth. And this kind of therapy is a drug-free approach to help you stop chasing temporary band-aids and function like an optimal human should in the areas of sleep, stress, TMJ, hormones, oral, basically everything. But today we're going to focus on stress. And she's going to share the connection between your tongue, your stress, some quick fixes, and how to know if you should seek out this kind of therapy. Patient advocate, cat mom, all around mouthy, Sara Mercier. Thanks for being here.
What an introduction. Thank you so much, Meredith. It's so great to be here.
I think all around mouthy should be like on the 3 bullets of your Instagram profile.
I might have to read it because yes, everything mouth related, I fixate. It's that dental hygienist in me.
Well, that's so funny that you said that because I was going to ask you about that. You know how hair people obsess over hair, they notice it in public and it can be distracting to them. It drives them crazy, right? Everywhere you go, yes. Do you notice people's tongue posture?
Oh man, I notice everybody's anything to do with their mouth. I zoom in and I try to be polite and I try to make eye contact while they're speaking to me. But undoubtedly, the eyes start to travel down to the mouth and I'm looking at the teeth. I'm looking at the tongue posture. I'm looking at how their jaw grew. I think this is like a thing. I'm sure if you're an optometrist, you start looking at eyes. I'm sure if you or you work on some other part of the body, you start looking at it. But yes, mouths is where I zoom in and I start thinking of all the things I would love to tell that person without overstepping. So I want to be like, hey, I can help you with your tongue. And I need them to be like, what are you talking about?
Yeah. What do you mean you're going to help me with my tongue, lady? So oral health is health, obviously. But I mean, is it that obvious? Because when it comes to our health in general, we tend to think of everything from the neck up as cosmetic first, right? When people talk about getting braces, it's like for cosmetic purposes. I have never heard anyone talk about getting braces for a health reason. And I'm picking on braces because that's the most common, thing that we do. Even like a septoplasty, it's like, oh, well, I'm fine. With septoplasty, for those who don't know, if you have a deviated septum, your nose is crooked on the inside and you can't breathe too good. To correct it, I mean, a lot of people consider that, oh, that's, cosmetic surgery. So to kind of break that mindset for myself and for everyone listening, can you give some examples of what are some like myofunctional dysfunction?
Well, one thing I would say is about the medical field and the dental field, there's a separation that's a huge problem in the healthcare system in general. So people look at dentistry as one thing, and then they look at doctors and medicine as another. You have two different sets of insurances. You have medical insurance and you have dental insurance. And those two things are married completely. I always tell my patients when I'm practicing hygiene, I don't detach your head from your body when I clean your teeth and put it back on. You have blood vessels that run from your gums to your heart to your brain. Everything is connected. So when you're dental hygienist, when I take blood pressure of a patient, they say, why do you need my blood pressure? I say, because I'm giving you drugs that go in your mouth, but they go throughout your body if I give you anesthesia or anything like that. So I think it's really important, and we're really trying to push for it in the dental field, is marry the two together and remind people that your mouth is the entrance to the body. It has everything to do with your overall health. So back to your question of like myofunctional disorders that I see that are very common. Let's break down the word myofunctional. So myo means muscle, and then functional, of course, is function. So myofunctional means, how do your muscles function? Are they doing it correctly? Are they doing it functionally? Are they doing it dysfunctionally, incorrectly? So a lot of things that I notice with myofunctional disorders include low tongue posture. The tongue rests at the floor of the mouth, or lightly touching the teeth, or it kind of floats in space. Your tongue should be lightly suctioned from the tip all the way from the back of the tongue on the roof of your mouth. So if it's not, that's a really common myofunctional disorder. I see mouth breathing is another myofunctional disorder. Clenching and grinding, or bruxism, is a myofunctional disorder. So those are probably the most common ones that I see.
Okay, so like all of us, that's awesome. We'll talk about some.
I know everybody's going to be, where is my tongue at in my mouth right now?
Oh my gosh, it took me like a week to figure it out, Sarah, because since I started, cyber stalking you, I was like, where is my tongue? And I'm like, how do I feel my tongue? Hopefully other people don't have this problem, and I'm just sort of some kind of weird special case, but I really had to.
I doubt it, but continue.
Well, thanks. I had to bring awareness to where my tongue was, and it took me forever to figure out that it was suction to the roof of my mouth, but only the front part. And then I've heard you say that that's a thing before. So it's interesting to kind of make that connection in stuff that in areas of our body that we don't pay any mind to at all.
No. And that's myofunctional therapy. The whole goal is to get your tongue and your mouth resting where it should be and make it subconscious. You shouldn't have to think about it. This is where your body should rest for homeostasis, or to be like at rest. So that's part of the goal, is make it where you don't have to be thinking about these things. We want to make it subconscious and involuntary.
Yes. And exactly. And I can't wait to dive into that more. But first, let's talk about stress, baby. Let's talk about you and me. I couldn't help it. Sorry. That's total cringe.
That's good.
Yeah. Yeah. I think we all accept that sleep, or bad sleep, and chronic stress are definitely hand in hand. But what does tongue posture and poor sleep have to do with one another?
So when you're in your sleep, if your tongue is not resting where it should be, it doesn't keep the airway open. If you just imagine if somebody is in your room choking you like your throat, holding your throat closed, of course your body is going to go into fight or flight mode. It's going to say, what is happening? What is going on? It's going to wake you up out of those sleep cycles in different orders where we shouldn't. So this is where it becomes a problem with you're not getting the right sleep, you're not getting the right duration of sleep, and this can mess up your hormones, and for even the next day, your insulin levels. It affects all different types of the body systems.
So if this is a problem that people have from the time they're born, they might not know that that's why they have shitty sleep. They just be like, oh yeah, I'm a really, light sleeper. Oh, I have always snored. Yeah. What about sleepwalking and like talking in your sleep? Is that connected?
So those are huge red flags. And we also talk about like children who wet the bed beyond, like, even if you wet the bed in general, it's a sign that there's some type of disruption. But it's a real big problem if you wet the bed past like the age of 6 to 7, because your body is trying to get you out of deep sleep, and your body, that system should be shut off when you're sleeping. So if you have to wake up multiple times in the night to go to the bathroom, or you wet the bed, even some adults, this will happen occasionally. Like, they don't wet the bed all the time, but if they have a really bad night of apneic events, sometimes, and even an adult can wet the bed.
Wow, that that would be
Of course, they're not going to.
awful.
Of course, you're not going to walk around telling anybody that.
I
But
mean, it's probably not an opener at a party, but yeah, I can.
right.
How are you, Bob? Well, let me tell you, I had a bad
Yeah,
night.
exactly.
Yeah. So for you, I know you are very open on Instagram about sharing your journey to, whole health, including your tongue, your mouth, your jaw, all of that. Have you, since you've been on that journey, have you noticed a difference in your stress levels?
I would definitely say during the day. So this affects things at night and during the day. So my jaw is still smaller than it should be. So this is another consequence of myofunctional disorders and the tongue not being where it's supposed to be. So if the tongue is not suctioned to the palate, the upper jaw does not grow wide and forward. The lower jaw then cannot follow. The upper jaw essentially locks in the lower jaw, and that's where we have the mandible, the lower jaw, or the upper jaw blocking the airway. Things do not grow forward like they're supposed to. That's why, even if you have a square jaw, sometimes it can be misleading because you can have a narrow upper jaw, but still have some growth in the lower jaw. But necessarily, just speaking, a lot of red flags are the flat face, recessed chin, narrow palate that's more of a V shape, gummy smile, things like that. So when the tongue is not resting on the palate, growing it wide and forward, you get the narrow jaws. So I could really use some expansion. So even after my tongue tie release, I got a tonsillectomy. My airway is more open. It could be better. So I definitely know, and I was aware of that going into it, where it wasn't going to be 100% until I addressed those other things. So I definitely notice a difference when I'm sleeping, that I do sleep better. And during the day, I do notice that I do have less stress because my tongue is activating my vagus nerve, which we can kind of get into, but the tongue posture where I'm swallowing correctly, now that the back of my tongue moves properly, I'm in the rest and digest mode, and my body is at like baseline.
When you said rest and digest, something just clicked in my brain, and I thought about actual digestion. So, because if you're fight or flight, I mean, your body's like,
You're not, no.
we don't need
yeah,
food.
your body's like, we got other things going on. Like, digesting is the last thing we're going to do right now. We've got to run from a predator, or we've got other things we need to focus on. Digestion is not the priority. It's not the top of the list. So that causes a lot of issues with digestion. So if we talk about digestion in general, the mouth is the entrance to the gut, to the stomach, to the rest of the body. When you start chewing, that's the beginning of digestion. You chew, you break down food. You have enzymes in your saliva that start to break down, like carbohydrates and things like that. So chewing is the beginning of digestion. And then when you swallow, that's called the beginning of peristalsis, is how food moves through the digestive tract. So when you swallow food from your mouth, it starts peristalsis. It moves through your digestive system into your intestines, your colon, da 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 da. So what happens is, if the tongue is not swallowing properly, you're not activating that rest and digest nerve, and so that food can get stuck in different places, and we're just not turning on the right systems properly. Our body's a machine with different switches, and different hormones activate different switches. And so when our muscles are not working properly, sometimes those switches get mixed up, or they don't get turned on or turned off properly.
Why is this so common?
Well, so great question. The answer is we don't know. So we need to do more We need to do more studies. And of course, there needs to be like more funding. We need to do more studies. There are a few different hypotheses of why people have myofunctional disorders. A lot of times it's contributed to what we call tethered oral tissues. So that can include a tongue tie where the frenum or the connective tissue under the tongue is either too short, too tight, or it impedes function. Usually it's all three. So you can have a tongue tie, you can have lip ties, top lip, bottom lip. You can even have cheek ties, which are called buccal ties. And all of these things are supposed to dissolve in utero about 12 to 14 weeks. And if they don't, they can cause a problem. So why are so many of us having these myofunctional disorders? And usually tethered oral tissues that come with it. One hypothesis is the MTHR-FR gene, or the mother effer gene is what it's called. So that's one of the hypotheses, is that some people have this gene that causes some issues with connective tissue, stuff like that. Another hypothesis is possibly folic acid being the culprit, because since the 80s, when it's been really pushed that mothers should take folic acid to prevent spina bifida, to strengthen the spinal column, that's true. It does help with that connective tissue. But you can also, we think, maybe strengthen some other tissues along the midline, which is the tongue, down the center of the body. So we could be causing some things that way. Another thing that may happen is just genetics in general. There's some epigenetics where things are changing very quickly and rapidly, just based on our lifestyles and things. So if you think about it, 10,000 years ago, if you couldn't breastfeed because you had a tongue tie or a lip tie, you died. That's it. You were dead. You couldn't feed. Next, your genes do not get passed on. Now we have bottles. We have IBCLCs, lactation consultants. We have all these tools to help babies feed, even if they have these tethered oral tissues. So they're passing those genes on. And then we have other things like, IVF, fertilization, where maybe those genes wouldn't have married and now they are. And so so my clear-cut answer is we don't know, but we have a lot of theories.
Wow. I'm thinking of my husband. He got hit in the face with a surfboard once.
Oh no.
Oh my gosh, Sarah. It was blood everywhere. It was so.
Anything with teeth. I'm like, please, did he lose teeth? Please tell me no.
He did not lose teeth.
Oh, thank goodness.
I lost teeth, which I'm sure you've already figured that out by looking at me. Again, going to cover my mouth for the rest of the interview.
Wouldn't have noticed that. So don't worry.
Thank you. Yeah. The front four are crowns. Thanks to a bicycle accident in second grade.
No.
Oh, girl.
Oh, no.
I know. It's so sad. But when he called me and he was like, hey, I'm okay, but I think you need to take me to the ER. I came into the bathroom and it looked like he had no teeth because it was so much blood.
Oh, no. Blood. Oh, gosh.
It was awful. And the smell, awful. We went to the ER. The board had hit him in the mouth, like right here underneath his nose. Mm-hmm. They sewed back that little tethery thing underneath his lip. Is that what you're talking about when you talk about connective tissue? So you're saying the surfboard tried to free him and they put it back?
Well, yeah, kind of, probably. So a couple things going on. So you know what? It's insane. This is the worst, most ridiculous treatment plan I've ever heard. If your baby has a tongue tie, lip tie, and you tell your pediatrician about it, and I don't know where this came from, and I don't know why people are still learning this. Some pediatricians will tell parents, it's okay. They're going to trip and fall when they're like 3 or 4 and it'll rip. It'll rip anyway. I'm not joking with you. That's like a thing. And so I have parents who are like, yeah, but like my pediatrician said it'd probably rip. I'm like, where is that a treatment plan where they say, don't worry about it. Like you have a deviated septum, you'll trip and fall and you'll fix it eventually. Like that's not a thing. So when pediatricians say that, I want to look at them and be like, an injury is the treatment plan here, an injury that may or may not happen. It makes zero sense. But when you stop and think about it, it's like, why are we talking about that? So yes, a lot of kids will even say like, oh, I ripped my frenum, I ripped my lip tie when I was a little kid. I'm sure you ripped it. You didn't release it. So you may have partially released it, but the problem is you get scar tissue, you can get reattachment. So there's a difference between a frenectomy, which is where they go in and just release the skin and the connective tissue, but they don't test function. And so that's what we call a functional frenuloplasty. Those are two different things. So like your husband, maybe they reattach the frenum. Maybe they just reattach the skin of the lip, like to the attached gingiva to the gums right here. I don't know. I'd have to like see to be able to guess. But yeah, I've had some people say like, oh yeah, I was kissing in high school and making out and I ripped underneath my tongue. And I'm like, A, ouch. B, like that's a great story now that you can like tell. Three is I guarantee you partially released it. You didn't fully release it. There's no way you could have. So some people say like, oh, I had a tongue tie, but I had it snipped when I was a baby. Or like I said, the kissing one's I've heard like 4 people say that. Still, that's a lot. I feel
4 feels like a lot. Like,
yeah,
like it
said,
makes me feel like, what kind of kissing y'all doing?
Or like, how stuck was your tongue, you know?
Yeah.
So yeah, like it's interesting, but injury is not the way to release that. I'm just going to go on record and say that if you had an injury, that's not the way to do it.
Okay. Let the record reflect. Do not plan on having your surfboard plowed towards your face.
Correct.
That is not a good plan. Okay. Wow, this is so interesting. Night guards. I totally lost like where I wanted to go next. So because we were talking about sleep, we're talking about stress, and I can say from personal experience, when I go to the dentist, they're like, "Hey, you're grinding your teeth, and you need a night guard." And I'm like, "Cool, but maybe I should like try some not being stressed." Girl, it ain't going good because I don't know how to be less stressed. So the idea for myself and others that there's some sort of, function that form is therefore following that is causing my vagus nerve, and then all the things, obviously the vagus nerve is connected to so many things, really everything that is causing chronic stress that I've become accustomed to during the day. And then at night is manifesting in like teeth grinding. That is really fascinating. But would a mouth guard help for someone like me in that scenario?
So I'm going to put my dental hygienist hat on for just a second. I'm going to take off my mile hat. I'm going to put on my RDH hat.
Okay.
The dental hygienist in me wants you to protect your teeth. Okay. You have one set of teeth for your whole life. They're meant to stay in your head and stay healthy your entire life. So when people say, oh, you get old, you lose your teeth, that's not a thing. You only lose your teeth to disease. Okay. So either cavities, periodontal disease, gum disease. Your teeth are meant to last you your entire life. I had a patient who was 91. She had one crown and no missing teeth. And I was like, you are like exactly what I talk about to everybody. She was like my favorite patient. Her gums were immaculate. I was like, you're 91. I told you these are supposed to last your whole life. So they're meant to last you your entire life. So if you're clenching and grinding, you can fracture teeth. You can lose teeth because if you fracture it far enough, you can't fix the crown. If you fracture the root, it's done. It's coming out, the end. So you can fracture teeth. You can wear down enamel. Once enamel is gone, we can't put it back. You can do composite. You can do like filling material. It's not the same thing and it doesn't last forever. And every time we etch the tooth or adhere it, we remove enamel. So we have to protect your enamel. And the way to do that, the only way to do that right now, currently, like when we're just talking about night guards, it's to prevent you from clenching, grinding in your sleep is a night guard. However, that could actually make the root cause of the problem worse. So you're not clenching and grinding. I mean, you could be clenching and grinding because you're stressed, because you're choking. Does that make sense? So it's not your body is stressed. And so remember when we talked about if the tongue falls back, the lower jaw will move forward. It's to open the airway. It's not to, and sometimes you'll walk around during the day feeling like you're clenching your teeth together. If your tongue is not fully suctioned to your palate, it doesn't keep your jaw closed the way it's supposed to. And so subconsciously, you're going to be using your chewing muscles, your masseters, your buccinators. You're going to be using your chewing muscles to help keep your mouth closed. Your tongue suction is what should keep your mouth closed. So if your tongue is not where it's supposed to be, you've got extra weight pulling down on the lower jaw, and you will clench to try to bring the lower jaw up. So it's not necessarily stress. It could also be a compensation of your jaw kicking in where it shouldn't because your tongue isn't doing the right job. So then at night, we have you wear a night guard to protect your enamel. However, we just talked about your tongue not having room in your mouth and it falls back. What do you think happens when you put a giant piece of plastic in your mouth? It shoves the tongues further back into the airway. And this is where I wish I could go back in time. And we don't learn this in dental school. So I would say cut your dentist and hygienist a break if they recommended a night guard. We don't know what we don't know. This is not taught in dental school. This is not taught in dental hygiene school. the American Dental Association just came out with a statement. I want to say it was either 2017, 2018, that all dental providers should start screening for airway disordered breathing. And that's recent. Like that was only 5 years ago, 6 years ago. So this is very recent. So this is just now coming to the forefront of like, hey, we're in people's mouth all the time, and we should be looking at the airway that's like right there in the mouth. And so the night guard is at this point in time, if you're clenching, grinding, okay, it's the lesser of two evils to protect the enamel, but we need to fix the root cause, because now we're just shoving the tongue further in the airway and you're choking more. So the night guard, yes, it can prevent enamel wear and damage to the teeth, but it can make an airway disorder of not being able to breathe worse as well. So there's side effects. It's an expensive Band-Aid with side effects is what I call it.
We're going to take a quick break to appreciate those who support the show, including a cool podcast I think you'll like. When we come back, you'll hear the real meaning of holistic and things you can do today to improve tongue posture and decrease stress.
Have you ever wondered what it's like to be buried in an avalanche?
Weird foreign feeling of despair.
Or how it feels to crash a skydive?
I remember feeling my body hit the ground.
These are the stories you'll hear on the podcast called What Was That Like? True stories told by the actual person who went through it. And you'll hear actual 911 calls.
911, there's a man at my back door trying to get in.
Search for What Was That Like on any podcast app or at whatwasthatlike.com.
If you ever wonder where I find guests for the show, the answer is it varies a lot. And since it's something that gets asked a lot, I started including the backstory of each episode in my Monday emails. And then on Saturday, I share cliff notes and clickable links in case what you heard was so good you wish you could have taken notes. If you want to be included, text REAL to 66866 if you're in the US, or go to meredithforreal.com if you're elsewhere. If you're listening north of the state of Georgia, mosquitoes are not top of mind right now. But if you're in the Florida Panhandle or Gulf Coast of Alabama, you're already dusting off your grill and citronella candles. Make life easy for future you and get your property scheduled for a mosquito treatment with Insect. I've been using them since 2019 and they continue to impress me. They guarantee their work and pollinators are always top of mind. Check them out at ensec.net. If you watch the show on YouTube, then you see the beautiful backdrop of Trader John's, the exhibit where I record the show inside the Pensacola Museum of History. This is just one museum under the umbrella of the UWF Historic Trust. If you're planning a trip to Pensacola and need an indoor activity option, pick up a ticket. It's good for a whole week. Get your tickets in person so you can show the agent one of my emails and get $2 off an adult ticket. Now back to the show. Remember to stay till the end where I give you a sneak peek of next week's episode. Well, it's good to know that that is not the solution, but it's important to, not crack your teeth.
Correct.
From what I've heard you explain, you kind of take a multi-step approach that I would call holistic to help patients kind of reach that optimal state with their head and neck and their oral health. What stage is the muscle part? Because I've heard you talk about releasing different muscle things, and people who do have TMJ problems, like we were just talking about, usually have some tightness in the muscles around the neck leading up to the jaw. On the head, they usually struggle with headaches. So there's definitely an overlap.
For sure. I think so. To break it down, is there is no one size fits all. Everybody needs something different. Some people need expansion, where we do adult expansion either surgically or non-surgically with appliances. Some people don't need that. So it all depends on like what your needs are. I would say that with getting into a myofunctional therapist, having them evaluate where your tongue is resting is a really important start. Now, I totally agree with you. I take a very multidisciplinary approach to this because myofunctional therapy is great. It is not a one-stop shop. If you have a deviated septum, I can't myofunctional therapy away your deviated septum. We've got to work with an ENT, right? Mm-hmm. The other thing is the multidisciplinary approach to it. I feel like the word holistic has kind of been hijacked. And I made a post about this on my Instagram like a while ago, like probably a year ago, where holistic is seen to be as like woo-woo or like alternative medicine. Holistic means looking at a person as a whole. And that's exactly what I do. And that's exactly what everybody, any healthcare provider, anybody in the health space should be doing, is looking at the whole person. So the fact that something is holistic, I'm like, everything should be holistic. We should be looking at the whole picture.
Well, we
So I
should
feel
look
like
at ourselves in a holistic light. And I think that's the
True,
first step,
right.
because you're not going to create, I mean, this is getting a little whatever, but like, you're not going to, I know you're up for it, so it's cool.
Go for it.
You're not going to create market signals of, in a category unless you see yourself as a whole person and you demand, hey, I want support for this, or hey, I'm having a problem for this, or, I was just talking with a hormone guy, earlier, and he was talking about hormones and your brain health and, testosterone and memory. It's like, if we don't see ourselves as a whole person, then, and we are more susceptible to poorly outsourcing our healthcare, right? So we're like, okay, whatever you tell me, doc, I'll do. And it's just not a good thing. But if we see it as all connected and really make those connections, I think that's the first step to working with people like you who can really support that path.
I think you're totally right. And I think that one of my jobs is I'm a myofunctional therapist, but I'm also a patient advocate. I've been through the system myself as a patient. I've worked in the system as a healthcare provider. I work with doctors all the time. I know how to navigate the system. So I have a privilege of being a patient and also being a provider. So I tell my clients, probably 40% of what I do is myofunctional therapy with you. The other 60% is herding cats. So I make sure, when was the last time that your endocrinologist emailed your primary care physician? Probably never. I'm just going to go on a limb and say never. So I get all of the providers, if we're working with an airway dentist, if we're working with an airway ENT, working with me, a myofunctional therapist, I get everybody on an email thread and I say, hi, welcome to the team. Everybody, we are working on Meredith today, and we're going to do this, this, and this. Who's doing what when? So when you just talked about, well, there's tongue ties, there's muscles, there's this, there's that. The myofunctional therapy, we can start whenever. There's nowhere to go but up. It's basically, like you said, personal training exercises for the tongue and mouth. Now, you're going to hit a roadblock. You're going to hit a roadblock if you have anatomy that's in the way. So I can teach you to breathe through your nose, but if you can't physically do it because it's blocked, we need to address that. I can teach you to keep your tongue up in the back, but if you have a tongue tie and you can't physically do it, we're going to need to address that. So you have to do myofunctional therapy before and after tethered oral tissue release, or it's not going to be successful to the degree that we need it to be. You can also get reattachment, scar tissue, partial release, where underneath the tongue isn't strong enough to lift, so you can't release all of the tongue tie. So a good question to ask a provider is like, do you work with a myofunctional therapist? If you walk into an office, tell them you suspect you have a tongue tie. A, they don't know what you're talking about. B, they say you don't just because they look at it. They don't test function. And if they also just say, oh, well, I can snip that skin for you today, red flag, run away, like immediately go away, because they're not setting you up for success. So I think working as a team, it is also helpful. Some patients don't know what they don't know. And also you may have read something online that's not true. Like you may have, and it depends where you get your information from, but some patients will be like, oh, this is the answer. It's really not the answer. And so the healthcare provider may be correct. And then you're like, oh, I don't trust them though, because I read, you know what I mean? So I feel like it can be overwhelming and it can be very hard to navigate. So I recommend finding somebody that can help you navigate the system and get all of the doctors on the same page, because honestly, that's what you need in this day and age of how dissected everything is. Everybody's treating different things in a silo. Everybody's specialized in certain areas, but nobody talks to each other.
It's exhausting to be a patient and be your own advocate at the same time.
It sure is. It absolutely is. So I that's one thing I pride myself on is my clients say, like, you help me find the right provider. Finding the right provider is about 90% of the problem. This is very niche, and finding somebody with the right training is difficult. And I do all virtual myofunctional therapy. So I work with people all over the world. I currently am connecting one of my clients in Oslo, Norway, to a UK dentist who's had some training in airway things. So this is like a worldwide thing where we need to find the right providers. And I had multiple providers give me the wrong answers. Here where I live in Las Vegas, I had to travel to Los Angeles in California to get the right answers. So sometimes, unfortunately, they're not right in our backyard. But if you want the right answers, sometimes we got to go to those people.
Yeah. So what are some things that maybe people could try at home to either increase the awareness of what's going on with their tongue and mouth? And what are some things that they could do to try to bring some relief or remedy if they're not quite, ready to work with you or work with a different airway specialist?
Even just working on proper oral rest posture, even if it's not perfect, it's still a good habit to get into and to try to undo bad habits from infancy, childhood, adulthood. If you're a mouth breather, it changes the whole shape of your face. So the best thing you can do is just be aware of where your tongue is. Your tongue, when you say the letter N, if you say the letter N, like assuming you don't have a speech problem, say the letter N, the tip of your tongue will land on the gums just behind your two front teeth. That is what we call the spot. Some people have a little bump there. It's called the incisive papilla. It's a nerve branch. Some people have a bump. Some people, it's pretty flat. Mine's pretty flat. But when I say N, that's where the tongue is supposed to rest behind the two front teeth. And from there, you lightly suction the tongue to the roof of the mouth. If the back of your tongue feels like it's hard to get up or you can't lift it to reach the squishy part, red flag, you probably have a posterior tongue tie. That's where somebody like me comes in and helps you get going with that. But the best you can, keep the tongue on the roof of the mouth, lips closed lightly, breathing through the nose 24/7. That's the goal of all of this is normal resting posture.
And well, just doing those tips, well, do you think that would help with people's stress levels?
Yeah. So if you're breathing through your mouth, you're likely shallow chest breathing. And we get into this hyperventilation stage where you're actually not getting enough carbon. You need some carbon dioxide in the blood to get oxygen into the blood cells. So if you're hyperventilating, think about it. When you start getting anxiety attack, when you start getting anxious, it's that breathing, it gets your nervous system, you're working too fast. It tells your body like, we're about to start running. We're about to start doing some type of activity. Side note, you should be able to work out at the gym, run, all breathing through your nose, but that's a conversation we can have another time. But you should never breathe through your mouth. Your mouth is for eating and drinking. Your nose is for breathing. Your mouth is the escape hatch for breathing. It's only if you're sick and you're plugged up. If you couldn't breathe through your mouth, you would die. So obviously we need like an escape hatch for oxygen. But if somebody, is having that chest breathing where it's very shallow breathing, it can turn the fight or flight system on. And then we notice we're not taking those deep, relaxive breaths. If you've ever done yoga or you've done any type of breath work, you breathe in, breathe out slowly. Nobody's having you hyperventilate. They're not having you do that because that stresses you out, right?
Yeah, that's not a yoga class anybody's signing up
Correct.
for. Is there anything, as we wrap up, is there anything people can do for decreasing their stress through tongue and mouth techniques, posture while they're sleeping?
Really, when you're sleeping, your nervous system is on the autonomic. Things are just on autopilot. You're on autopilot. You can't tell your body, hey, body, put your tongue on the roof of the mouth if that's not where habitually it's resting or where it can rest. So during the night, I'd say, is there something you can do? One option is if you feel like you're a mouth breather at night, you can use mouth tape. There's different types of mouth tape. I prefer the VO2 mouth tape. There's also Myotape, different brands, Somnifix. But you can wear a mouth tape at night. However, I always add the caveat that I recommend that you get clearance through an ear, nose, and throat doctor because we just talked about the mouth being the escape hatch. We don't want to shut off the mouth and now you can't breathe through the nose. So you want to make sure that you're able to breathe properly, you get enough oxygen through the nose so that when you are breathing, you're not breathing through the mouth. So at night, you can use mouth tape. Again, it's no pun intended, it's a Band-Aid. So we need to figure out why do you need mouth tape? Why is your mouth not closing on its own? But in the interim, in the meantime, it's an option to help you nasal breathe and not have that chest breathing and mouth breathing at night.
That is really interesting. I don't think I've ever considered taping my mouth shut. Really fascinating stuff. How can people stay in touch with you? And certainly, how could they initiate working with you?
So I am on social media. My handle is @healthymouth_healthylife. So I like to post videos of what to look for in your own mouth. So if you're like, this kind of sounds like me, but I'm not sure, sometimes looking at a visual is really helpful. So you can message me there. My email is Sara at SARA, no H, Sara, no H, at revealmyotherapy.com. And my website, revealmyotherapy.com, has a lot of frequently asked questions. What are myofunctional disorders? What should you look for? Are you a candidate? And I just do 30-minute virtual consultations. So if you think it sounds like you, or you want some direction, if you want to find an airway provider near you and you just don't know where to start, I'd be more than happy to get you on your way, getting to the right people that you need to see.
Awesome. Well, thank you so much for having this discussion with me today. This was awesome.
Well, thank you so much for having me and for that great intro.
Thanks for listening. Did you think of someone you know while you listened? Help me grow the show by sharing this episode with that person. And if you liked this episode, you might also like the one I did with a researcher and inventor who's developed de-stressing earbuds. It's episode 154. Stay tuned next week to hear a mixtape I made for you of the best clips from my episodes relating to sex and society.